Medical items were on January 30, 2026 donated to the ABUAD Multi-System Hospital at Ekiti by Dr. Munisola Adeyemo.
This is very good in
suction canisters,
in the intensive care unit. When you have a patient who cannot eat and they are vomiting, this is the suction canister where you put on the wall, you suction whatever you need to suction out. And I think in the ICU you should have this by every patient.
Yeah, we have by every bedside.
I have a lot of them in the boxes.
Yeah.
So many of these there. For every patient with the suction itself, it's in the back.
And there are surgical gowns.
I have surgical gowns, yes.
All sorts of
yes.
medical consumables.
Yes.
Speaking at the event, Dr. Adeyemo said her motivation was to contribute to national development, stressing that it is not always about what the nation can do for citizens, but what individuals can give back. She disclosed that her survivor from a past stroke, through God's grace and timely assistance from others, inspired the gesture. She added that although she had carried out similar donations before, this was her first in Ekiti.
My mission is, don't always ask, what can I get from you? What can you do for your nation? That is one of my missions. Many years ago, I have had my name. I did so many medical missions here in Nigeria, including my village. I went to Ogun State. I went everywhere to do free medical mission. I will bring out these supplies, give it to people. They know me here very well. It's only in Ekiti I could not be able to do this. So when I came with all these equipment, first of all, I told people, they said, why do you want to do that? Why don't you open a shop and say that? I said, what? Do I need the money? I need to touch other people's life because I'm a benefactor of a good Samaritan in my life. I know what I went through. If not because of good Samaritan, I won't be standing here. In 2004, I suffered a massive stroke. The only people that you saved my life. I should be able to save other people's life too. They asked me to take it to the general hospital and give it. I said, no, why would I do that? Let me donate it to this man who has been a benefactor of many good things in this area. People, we know him very well in the US. From John Hopkins, I work in John Hopkins too. We know him. I know your partnership with John Hopkins.
Yes.
They know Areba Balola there. I said, let me make an impact in this hospital because he has done so well. Let's do something to uplift his morale so he can do more for the less privileged ones. That is the mission of coming here today, to donate this. It's not for monetary benefit, money. What is that? I can do more if they give me the privilege.
The chief medical director of the hospital expressed appreciation to Dr. Adeyemo, thanking her on behalf of the management and staff for her generous support.
This hospital was established to, one, provide the best quality of healthcare at the most affordable rates to our people. One example is our kidney transplant program, which is headed by Dr. Ogutola beside me here. Last month, we called our pressmen here to update them that since we started our kidney transplant program, we had completed 40 kidney transplants as of December. And as we're speaking now, they are in theater doing the 45th kidney transplant procedure. So these are procedures that in the past, people would have to travel out of the country to get. Yes. Now they are getting it in Ekiti. We have had patients from Ado here who have come here, had their transplant, and are now living healthy lives. And last time we had a set of transplants, we had a patient who came in from the US and had a transplant and has gone home healthy. Now in this current set of 5 that we're doing, we have another person from the US who has come for a kidney transplant procedure. So we are gradually reversing medical tourism. And we can only continue to make progress if people start to look inwards. If everybody who is rich or blessed like Araya Fabalola decides to establish a hospital like this in their own location, you will solve the problem of unemployment for health workers. You will solve the problem of poor health indices, maternal and child mortality indices and things like that will come down. And then we'll all be better off for it. A nation that is healthy is prosperous. So if we can take care of our health, then we can prosper. So once again, we want to thank you for your noble gesture. And on behalf of the founder, we pray that God will continue to uplift you and strengthen you so that you can do much more than this. And we believe that this one that you have done will reach out to others all over the world, Nigerians who have benefited from other people's benevolence or not, but are capable. They will also see that they can come back and give to society and make our lives better. So on behalf of management, we want to say thank you very much.
Thank you, sir.
And God bless you.
The donation underscores the importance of individual commitment to healthcare community service. Olamileko Anthony, reporting for Puff TV.
People of the Fountain.